Okay, so good morning, good afternoon, depending on where you are based. On behalf of the World Health Organization and the HealthPros Network, welcome to this webinar on which we are launching a new study on the development of COVID-19 dashboards in the WHO European region. Thank you so much to all the participants for connecting with us today. My name is David Novillo, and I am the Unit Head for Data, Metrics and Analytics at the World Health Organization, the Regional Office for Europe, based in Copenhagen. And it is my pleasure to welcome you today. Before continuing with the agenda, I would like to make some housekeeping announcements. So first of all, if you have not done so, Google appreciated if you could please identify yourself in the participant list with the name of your country, followed by your full name. You can do this going to the participant list and clicking on your name. Then you will see the option rename. That will facilitate the discussion during this webinar. This webinar will last 1 hour and can be followed in English and Russian. As you can see at the bottom of your screen, you can choose the language in which you would like to follow this webinar. Furthermore, at the top of your screen, under the option Overview, you can choose the language in which you would like to see the presentation of this project. So in addition, we would like to inform you that this session is being recorded and will be available after the session on the HealthPros website. In today's webinar, we will be discussing COVID-19 dashboards. We are joined by a team of researchers presenting the Marie Curie Innovative Training Network, HealthPros, who will be presenting some of their earlier work on COVID-19 dashboards, as well as a new joint study being developed by the WHO Regional Office for Europe and HealthPros on the development of COVID-19 dashboards in Europe. Over the course of the hour, we will also have ample time to discuss. We are keen to address any questions from those on the call about how a dashboard you are working on or aware of can participate in this study. We also welcome any suggestions of topics or considerations that you feel should be explored. Throughout the presentation, please use the chat to ask questions for post comments. You do so in English or Russian. Following the presentations, we will have the chance to hear back from the different speakers. So before we begin, it is my pleasure to introduce the co-coordinator of the HealthPros Network, Professor Nick Lasinga. Nick, please, the floor is yours. Thank you.
Thank you, David, and also good day, everybody. And thank you for participating in this official launch of a joint HealthPros WHO Euro work on Corona dashboards. As you all are aware, to handle the pandemic, data are crucial. We want to know how many people are infected, how many people are using our hospital capacities. And at the moment, it becomes more and more relevant to know how many people are vaccinated. So countries all over the world make an attempt to collect that information and make it available for their populations. And that's why dashboards have become a more and more important tool of communicating all the knowledge and the insights about the corona pandemic in a wider sense with the population. As David said, my name is Nick Lasinga. I'm professor of social medicine at the Amsterdam University Medical Center, but I'm here in my role as one of the coordinators of the HealthPros Network, a research network of researchers that actually started 4 years ago with funding of the European Union to look at the way how performance intelligence is developed and used in healthcare. So basically, how do we collect data on how healthcare is functioning and how do we report about it and does it have an impact? But as you can understand, when the pandemic hit last year, we started to looking at dashboards, and happy to present in this webinar some of the results. But we also hadn't expected that would last that long. We thought it was a quick fix, an attempt of countries to communicate a pandemic, but you now see that dashboards become increasingly important as a tool of how governments communicate with the public about the various phases of the pandemic, but also the various measures they take and the impact of these measures. So we think it's a very good idea to have join forces with WHO Euro and have a joint attempt to actually connect with all the developers in the different member states in the European Union to help them, support them in thinking through how to optimize the dashboards and their working. So again, welcome on behalf of the HealthPros, and I hope this webinar is not only informative, but also will stimulate you to participate in the program.
Thank you so much, Nick, for your kind words. And now it is my pleasure to introduce Dr. Natasha Sopardi-Muscat, Director of the Division of Country Health Policies and Systems at the World Health Organization, the Regional Office for Europe. Natasha, the floor is yours. Thank you.
Good morning, good afternoon, and thank you very much, David and Nick, for your kind introductions, but also for the efforts that you have put up to hold today's webinar. I want to welcome all of you to this webinar, which is dedicated really to launching a new project on the development of COVID-19 dashboards in the European region. And we really appreciate you taking time to be with us today, despite the hectic schedules that everybody is working towards. Why is this topic important for public health? I think for those of us who are here today, we are here because we all clearly understand the value and the importance of having timely, credible, reliable, and actionable data in order to enable more evidence-based decisions for planning and prioritization of healthcare interventions and activities. Of course, I think this was amply evident before the COVID pandemic, but in the past months, we have seen how timely, credible data availability is more important than ever. In fact, since the start of the COVID outbreaks, several hundreds of organizations, including WHO, NGOs, governments, academics, philanthropic organizations, and even the private sector, have initiated a number of open access data dashboards that are accessible even to journalists, to the lay public, to serve as dynamic visual tools for communicating and making accessible scientific data to the public. This, of course, was also possible thanks to the availability of new information and communication technologies and access to open source web-based software. However, effective use of the dashboards and public reporting does not only depend on the availability and accuracy of the data, but also on the actionability of the dashboards. And this in turn then depends on many other factors and is going to be the focus of our discussion today. So I think the topic of today's webinar is very important because it represents an effort to make the bridge between production, dissemination, and communication of the data to then move towards accurate and timely decision making. Of course, this is very important for us within WHO, also because a recent study on the features constituting actionable COVID-19 dashboards, which has been conducted by HealthPros, showed that there are certain features that may enhance the actionability of dashboards. And of course, we hope that the lessons that we are learning from this COVID pandemic may also be very instructive for us in other areas of public health, where we have intractable problems and where we need to bridge better between knowing what the problem is, reading the data, and then taking incisive, timely, and relevant action. The study also showed that understanding the perspective of the dashboard developers may help us also to strengthen the dashboards for the benefit of public health reporting and strengthening of national information systems, which is a priority area of focus identified in the European Programme of Work, where we talk about moving from the why and the what to the how, to implementation. And this is why we as WHO are very eager to collaborate and support the study in the hope that it can help us to identify lessons learned for overcoming challenges and result in strengthening of future public reporting and actionability of dashboards. As I said, this initiative is very much in line with our European program of work, which includes engaging our large health information networks throughout the European region and supporting data collection and implementation of research. So today we are asking all of you to collaborate as part of this project, to contribute to this initiative and to our collaborative efforts to make our public health programs in the future even more data-rich, information-rich, and action-rich. I thank you for your attention and thank you in advance for your contribution and effort. We also look forward very much to learning from you over the next hour.
Thank you so much, Natasha. So thank you so much, Nick, too, for your words. So now, following the agenda, I am pleased to hand over to our HealthPros colleagues, beginning with Dr. Dion Gringos, co-coordinator of the HealthPros network. And Dion, the floor is yours. Thank you.
Thank you very much, David. May I have the next slide, please? Is it possible to? Yes, thanks a lot. Well, good afternoon and good morning to those of you to this launch event. The project that we are presenting today and that we're launching is the result of a collaboration between the WHO Regional Office for Europe and the HealthPros Training Network. Let me first introduce to you the HealthPros Training Network, of which myself, Nick Klasinga, and the next speakers are a member of. Next slide, please. HealthPros is a European Commission-funded training network, innovative training network for healthcare performance intelligence professionals. So HealthPros stands for Healthcare Performance Intelligence Professionals. It sets out to train 14 PhD candidates throughout Europe into a first generation of healthcare performance intelligence professionals who are able to make effective use of available healthcare performance data in countries to improve various performance areas such as integrated services delivery, patient engagement, equality and access to healthcare, and health outcomes. The training network, it's a 3-year program of collaborative and multidisciplinary and innovative training for the PhD candidates, but they also perform innovative research projects in which they develop tools and implement methods to streamline healthcare performance measurement, the development and application of performance-based governance mechanisms, and the eventual effective use of healthcare performance intelligence by the different end users. The network itself, it's led by the Amsterdam University Medical Center in the Netherlands, of which our group is part of, and a joint consortium of both public and private partners from Denmark, Germany, the UK, Italy, Hungary, and Canada, of which the logos can be are displayed on the slides. Next slide, please. The HealthPros Consortium has developed and implemented a framework of performance intelligence that you see on the slide. The pyramid that you see shows a hierarchical structure with healthcare data and indicators at the basis of performance measurement. And these are the fundamental elements that have been found to be rather weak since the inception of COVID-19. So the challenge is not, like Nick said, it's not a shortage of technology and our ability to collect the data, but it's about their meaningfulness. And as Natasha mentioned, it's about the actionability. So HealthPros is really about developing our understanding of what makes an indicator and information actionable for decision makers. So that we can actually fully leverage the day-to-day operations, data into our day-to-day operations for the appropriate handling of, for instance, a health emergency. So with HealthPros, we intend to improve the step from data to action by getting the most out of our data-rich systems. And to be actionable, we say that information should be both fit for purpose, meaning that it meets specific information needs, and fit for use, which means getting the right information into the right hands at the right time in a manner that is understood by its end user. Next slide, please. So the COVID-19 dashboards have indeed been widely developed as a communication tool for public reporting on the states of the pandemic, for instance, by showing key performance indicators related to COVID-19, using some form of visualization and offering this in an online web-based format. We believe that exchanging experiences on their development and lessons learned may offer future preparedness for reporting on future public health crises, hence today's webinar. So now I would like to give the floor to one of our HealthPros fellows, Damir Ivankovic, to introduce the background of the new project on COVID-19 dashboards. Welcome to Damir, and next slide, please.
Thank you, Diana. Exactly, thank you for the introduction. And I will do the second part of introduction, which is basically talking about this study, which preceded the one that we're kicking off today, working with dashboard developers. So basically the team, the HealthPros team that Diana just talked about. So the team of, I think we had in total 17 researchers working on this project in mid-2020, specifically in July. We assessed 158 publicly available COVID-19 dashboards in 53 countries. The results of this work are now already available in an article that you can see cited here. The aim of this study was to explore state-of-the-art of COVID-19 dashboards in July 2020. That's when we did the assessment, but also then through a series of expert nominal group process consultations to come up with a useful and meaningful list of features that constitute actionable dashboards. So dashboards that provide data that is fit for purpose and fit for use by its users. In this study, we wanted to answer 4 research questions, and they were based on why, what, how, which was already mentioned. So why and for whom are these dashboards developed? What kind of information is presented on them? How is it presented? And then finally, as I said, we wanted to see what differentiates actionable dashboards from less actionable ones. Or specifically, we wanted to see what are the features of actionable dashboards. Now I'll just briefly run through main results of this study, and I guess most importantly present these 7 features of actionable dashboards that we identified. We can go to the next slide, or we can already then skip the next slide. We can go 2 slides. Yeah. So yeah, I've talked about this study. We can go to the next one, which is a short overview of these 158 dashboards that we assessed. As you can see, we did cover all the, for instance, WHO regions, but the most dashboards mostly came from the European one and the North American region. And out of 158 dashboards, majority did national level reporting primarily, which doesn't mean that dashboards only did national level reporting, but that was their primary level. And again, most of them were governmental reporting. We also looked at independent initiatives, international organizations, media outlets, academia, industry. But again, most of them, I would say 2/3 were governmental reporting or government appointed reporting. Next slide, please. Under the what, so just main results, there's more, and if you're interested, I highly recommend that you have a look at the article. Under the why, the main questions were, is the purpose of the dashboard's reporting stated clearly on the website? And also, is the intended audience stated clearly? And we see that under 1/3 of dashboards, publicly available dashboards, really do say why are they there, what is the purpose of reporting. They rarely can do that explicitly, and even more rare was the mention of who the dashboard was intended for. And you can see some of the examples on the right side. Next slide, please. Then we looked at what was reported on these 158 dashboards from around the world, and what was the kind of the data load or the information load, how many indicators or indicator teams, as we classified them, were reported. And it was between 1 indicator and up to 15 or more indicators grouped in these indicator teams. On average, these dashboards reported around 5 indicators. And we can see that mostly these were related to the so-called spread and death or epidemiological data on the number of cases, number of deaths, active cases, and so on. Following that was the information or indicators on testing rates, testing capacity, and also health system capacity. So hospital admissions and ICU admissions and the use of ventilators. So this was basically the most reported indicators on these 158 dashboards. Next slide, please. Further on, then we looked at how, as I said, so we went why and what and how. Again, these are only the main results. We looked at what kind of data, information, or indicator breakdowns were available, and 2/3 of dashboards did have breakdowns, additional breakdowns available, and mostly this was focused on age and the sex breakdowns, and rarely it was included, for instance, ethnicity, race, socioeconomic status, and then desegregations for specific populations like healthcare workers or long-term care facilities. Under how, we also looked at how was the data visualized and what kind of visual aids were used, and we see these were mostly graphs, charts, followed by maps and of course tables, and this was relatively prevalent in these dashboards. Then we looked at, is the data interpreted? And by interpretation, we looked at the interpretation of quality of data, interpretation of the meaning of data. By quality, we were looking at whether potential differences in numbers of figures were explained, or the issues of data availability or reliability, whether these were kind of stated or disclaimed on the dashboard. And under data meaning, we looked at whether there was the explanation of what the analysis or what the data signals. So for instance, whether a certain number going down is a good thing or a bad thing, pandemic-wise. And we can see that out of these interpretation aspects of dashboards, that just over a half had some or both of these types of interpretations. We also looked at data simplification techniques, which are one of the features of dashboards, and most of them did use a certain type of color coding, while other types of simplification techniques were used less often. Next slide, please. And yeah, as I said, the whole analysis, the assessment of the dashboards, then through a series of expert consultations and processes related to a nominal group techniques, we did score these dashboards, and we did identify the highly actionable ones, and then we went back to look what makes these dashboards highly actionable. And as I already mentioned, we came up with 7 features, which we tried depicting in this ideal kind of dashboard, which would have all 7 of them. So the first one would be knowing the audience and their, so next slide, please, or the next move. So we can see the first feature, exactly, thank you. The first one was knowing the audience and their information needs. I've already talked about our results of how many dashboards, in fact, did have the audience and purpose of reporting stated explicitly. And we saw that those that were scored highly actionable did have this feature. We also looked at multi-language support. Only, I think, around 20% of dashboards did have multi-language support. Second feature was managing the type, volume, and flow of information. Again, this was quite clear that not too little indicators or too many indicators was probably not ideal, and also how the data flowed through the dashboard, and whether a variety types of information were used, so not only the epidemiological one. The next feature was making data sources and methods clear. So if we can show it also. Making data sources and methods clear. This one again seems kind of self-explanatory or logical, but we saw that 24%, sorry, 1/4 of dashboards that we assessed did not report on their data sources, which was again probably not as acceptable and not characteristic of the highly actionable ones. The next feature was reporting time trends, and reporting time trends in relation to policy decisions. Again, majority of dashboards did provide time trend data through the duration of the pandemic, but 1 in 8, for instance, did not, and very few did link the data showed in also graphs and charts to certain policy decisions which were made and measures that were introduced at certain points. The next feature of highly actionable dashboards was providing data close to home. So providing a more granular geographic breakdown, which would bring the data closer to the kind of the needs and the setting where a person visiting the dashboard or the user of the dashboard is. We saw that 2/3 of the dashboards that we looked at did provide different levels geographically of data, but still very few provided very detailed to kind of postcode level data to the user. The sixth feature is a breakdown of data to population relevant subgroups, which I've mentioned in the breakdown results, where we saw that mostly when it was available, it was mostly on age and sex, and less so for other population characteristics. And the final feature that we identified was the use of storytelling and visual cues. So a concise narrative explaining the significance of a trend, for instance, would be what would differentiate highly actionable dashboards from less actionable. So this was very briefly the results of our study on the global sample of dashboards. And I will now hand over the floor to Erika, who will introduce the work that we're kicking off today. Thank you.
Great, thanks, Damir. Super. So in the next few slides, I'll briefly introduce our new joint study. Next slide. Now, in terms of setting out the context for this work, just to position a bit our understanding or the research gap that we observed from our first study. So while our earlier work had looked to describe and explore the actionability of the dashboards, what we found was, in terms of what we missed, was the perspective of the developers themselves and the real world decision making faced in terms of selecting the data and identifying indicators, as well as the hurdles in terms of time and resource constraints. And thus far, the information collected from the perspective of developers has largely been anecdotal. So we see here an example of an interview of Johns Hopkins coronavirus dashboard team that shared the development process and a decision that was essentially made overnight, and the dashboard that was built that day, which would go on to receive 1.2 billion interactions per day in May of 2020. So we know the dashboards are used and they're extremely important, and they can also be heavily critiqued at times. So we really wanted to be able to leverage the experiences of the teams that have been running these day to day and take stock of the lessons learned from that process. Next slide. So this study set out with the aim to collect these insights and explore the development process of COVID-19 dashboards from the perspective of their teams. And in doing so, to identify the facilitating as well as hindering factors that were faced. And jointly with the participating developers, we hope to identify lessons learned and recommendations to strengthen future public reporting in the context of a public health pandemic. And these aims inform the study's two key questions. So first, to describe the development process, and second, to understand better the facilitating and hindering factors. Next slide. So the study is designed around two key phases that begin and end with webinars like this. So since the beginning of this year, we've been working to set up the study and developing the study materials. And more recently, we've begun to reach out to the existing network of European health information focal points, as well as other contacts in our network, to identify and connect directly with the dashboard teams in the European countries. The next phase begins with the interviews, where members of our study team will be meeting bilaterally with the different developers in 60-minute interviews to discuss with the teams. And we have a team of about 8 different researchers, and together span 13 different languages. So we're really hoping we're able to connect with as many teams as possible and engage across the region in this process. Now, the second phase of the study that follows, we hope will take place before the summer holidays. And in that phase, we'll be convening the participating dashboard teams in workshops to directly exchange and share experiences. In these workshops, we'll be presenting back the findings from our interviews and some initial reflections of key findings, but we really hope to discuss those and co-create recommendations based on the results. And our intention is to disseminate back in a similar public webinar the results in the fall. As well, we expect to prepare the results as a scientific article for publication. Next slide. So recruitment is very much still ongoing, and we're really keen in the discussion portion of today's webinar to answer any questions, and also we'll highlight ways to get in touch in order to participate in this study. So first, in terms of the types of dashboards, we have some key criteria that we've set out to scope the inclusion of dashboards for the study. There's three. The first is that our target is a national level dashboard. So we're trying to engage country dashboards that may, of course, be reporting subnationally, but have a national scope in their overall focus. Second is that the dashboard is developed by a public or government organization. So we really want to capture organizations with a mandate to public report. So we are excluding dashboards that may be run by academia or think tanks, unless, of course, they are mandated to do so. And the third, perhaps most obvious, is that our focus is specifically on the WHO European region countries. So we're targeting the member states across the Euro region. Now, in terms of the individuals to participate in the study and contribute to the interviews and workshops, here we're targeting those that have ideally been involved in the dashboard since the outset, or at least have a good understanding of the decisions made along the way. And we recognize that that might include multiple members of a team, so we leave it to each of the dashboards to suggest and identify those individuals that are best to be involved. And what does it mean to participate in this study? Well, we are mindful that our target is extremely very busy teams, so we have tried to be cautious in the time commitment. We foresee the interview, and we've tried to organize that as a 60-minute discussion, and the follow-on workshop. We really hope that all participating or dashboards that participate in the interviews will also contribute to the workshops. And through the process, of course, we're co-creating and developing the lessons learned from this process. We do also hope that dashboard developers can benefit from the resulting network of colleagues across Europe to share and continue to collaborate with as well. Next slide. So this overview of countries maps those that we've been in touch with thus far, though it is outdated now because it's correspondence up to last week. And it just highlights where we have been in touch with a dashboard team. But if you're from a country that we don't currently have correspondence with here, we would really appreciate to get in touch, or if you can suggest colleagues that we can be in touch with to explore their interest to be involved. And in terms of how to do that, if you can go to the next slide. So just an overview of ways to get in touch and different possibilities to participate. So if you are interested to participate and your team has yet to be in touch with us, please do send us an email, and we can connect you with a member of the study team to coordinate that and share with you some of the developed study materials. And our contact details of Demi and myself are here on the right side. If you have a colleague that you think might be of interest, or that might be of interest to participate, please do put them in touch with us as well, and we are happy to share them in the materials with them. If there's a topic that you think should be explored in the discussion portion of the webinar now, we're really keen to collect your insights and suggestions. Perhaps it is already part of what we're hoping to explore, but if there are particular aspects of the development process that you think there could be great learnings by exchanging across countries, we really welcome that feedback. And if you simply want to follow the results of this work, we keep updated our website, and through Twitter and LinkedIn, we share any webinars and publications. You can also send us an email and we'll be sure that you'll receive updates that we share to participants by email as well. Next slide. Yeah. So in closing now, and I'll hand it back over to Nick to start the discussion, but first just a thank you to the full study team. There's many hands, and we span many countries and time zones, but it's a great collaborative effort. So thanks to everyone here and on the call, and yeah, we can end it here, and I'll hand it back to Nick for the discussion. Thanks.
Thanks very much, Erika, and also Damir and Dionne for explaining the background of the previous study, but especially the setup of this this new study. Yes, there is there is time for discussion. So if you have any questions, please either put them in the chat box or raise your hands. But happy to get via always possible your input. Any questions already? I noticed already that Estonia, that you entered your experience in the chat box, and of course that's very much appreciated. So we very much like to be in touch with you. Do you have any other question or remark about the setup that was presented?
Well, yeah, thank you. From my side, I wouldn't currently say that I have any questions. We would be happy to cooperate and get in touch further to discuss. And we would be happy to learn from other countries as well. So one of the difficulties we faced last year when starting the services were we wanted to publish open data sources which can be used by all sorts of consumers and analysts who can make their own visualizations. But we didn't find a good standard in terms of how to format that data and so on. So we came up with our own solution, publishing both CSV files for Excel consumption and JSON files for developers. But yeah, it would be good to learn on the experience of other countries as well.
No, excellent, and great to have you in, and please mention these aspects, because we hope that this turns into a learning community, that we kind of can accelerate the learning of the teams of developers, because you're probably very busy in your own environment doing things as good as possible. But part of this study is to really try to build this into a learning community where you quickly get in touch with fellow developers in other countries, and you can learn these valuable lessons. And as I said, as a research team, we're very happy to facilitate that. Excellent. I see now some more people reacting in the chat box. There's Petronella Bogart, and after that I go to Matilde Valente. Petronella, could you want to be part, but I don't see any country there. Could you please inform me where you're from and which group you would like to include in the study? No reaction from Petronil at the moment. Let me then.
Petronil is our colleague from Belgium, representing the European Health Information Initiative. So we will reach out to Petronil to be sure that she is part of the study. Thank you.
Excellent, good. That's always the problem. Over time, we get more specific and making sure that our name is linked to a country, because otherwise it's very difficult to find out. Matilde Valenta, I have an assumption about where you're from, but please present yourself and then raise the point you want to make.
Hello, thank you very much. I'm Matilde and I'm from Portugal. I have a company called Social Data Lab, which is a statistical company. And first of all, I would like to congratulate this initiative, which is very important, and we are happy to join to the group and to discuss and to learn from all the countries. My contribution is that we developed in our company a COVID dashboard, where I think that maybe is innovative is the fact that we introduce and we relate social demographic variables about the municipalities of regions of Portugal and the other countries, and we try to relate in which countries we have specific COVID effects. Imagine if it's the more developed countries that have more cases or deaths or COVID vaccination. So we try to relate a huge amount of social, demographic and economic variables with the COVID outputs, which are regarding not only deaths or cases, but also vaccination, etc. And even the cases absolute numbers and relative numbers, such as divided by population or something. So I'd like to ask if you saw in your study this orientation and this kind of investigation, which is trying not only to look to clinical outputs and health outputs, but also trying to relate lots of different dimensions and try to understand what is happening in between the countries, so in the regions, but also comparing lots of countries which have different realities. So my question would be, what is your experience, and if you feel that this kind of analysis is interesting for the community and for the public makers as well?
Thank you for the question. That really relates to the scope of the dashboard and the depth and the level of granulation with which you present various variables. And before answering, then Erika Damir, would you like to respond?
Yeah, sure. Thanks. Yeah, for the last year's study on the global study on dashboards, we did for sure look into the varied types of data and information provided through dashboards, and we did anchor our work and the analysis in a WHO Euro report from, I think, April last year, which did emphasize the need to not only look at epidemiological data, but to look at health system or dual track health system management data, to look at behavioral insights, to look at social and economic implications. And this was one of the things for sure that we did look at in the dashboards. And as the results show, and also the paper presents, well, a minority of dashboards did have this kind of varied data landscape presented in them.
Yeah, so the short answer is yes, it's interesting. Of course, it depends very much on what you try to achieve with the dashboard. But we see over time that they get more mature, and especially and then expanding to behavioral data, socio-demographic data, and really trying to understand the whole story. In the beginning, it was more the epidemiological realities, but over time, it's more learning from the compliance of population, citizens with lockdown measures, and having that whole basket in your dashboard. So that's surely a development we've seen, and what we want to explore, of course, also in this follow-up study, to see what is the scope and the depth of the data and how are they actually used in the country to continuously monitor and improve the measures and the policy initiatives.
Thank
You. I see the hand was also raised by Liana Juk from Sweden. Liana, could you please bring your point?
Hi, I just wanted to introduce this it's really great study. It sounds really, really interesting. We are just at the start of developing our own dashboard for Sweden. So I think there's a few of us on the call that work with SciLife Lab in Sweden, and we are responsible for the COVID-19 data portal in Sweden. So it's been really interesting to hear about the different features, the different dashboards use. So I just wanted to sort of say hi on our behalf, really.
Perfect, thank you. But you say you're now starting to develop a new dashboard. Why now? The pandemic started more than a year ago.
Yeah, we're getting quite a lot more data in now, and we want to make it as user-friendly as possible. So we are developing something that we hope will inform policy across Sweden a bit more and things like that.
And you're also planning to have then a broader scope in the types of data there?
Yes, hopefully. We're hoping to get quite a lot more data in over the coming weeks and months. So we're hoping that can supplement what we already have with the COVID-19 data portal.
Thank you. Thank you very much. I see there's a question in the chat box from Federico Pretellesi from the European Commission. Would you like to repeat your question, Federico?
Hi, Nick. Hi, everyone. Can you hear me?
Yes, I can.
Hi, thanks. No, thanks a lot for this very interesting work of yours on dashboards, which really is. I mean, I find it extremely interesting. So one question I had, perhaps a bit off track and not within 100% the scope of the project, but I just think that from your point of view, you may have a lot of knowledge on this. So what is your assessment of the value, let's say, of basically allowing users to play with the data on the dashboards themselves? Because on the one hand, I do see the appeal of it because it may make it more engaging or interesting for users to have some kind of dynamic interaction with the dashboard. But on the other hand, I see that there may be some pitfalls and possibilities for mistakes that may even lead to like wrong interpretations of the data. So I was just wondering what was your assessment of this? Thanks a lot.
No, thanks for the question, interactionability. Erika, Damir, you want to reflect on that?
Yeah, sure. Erika, do you want to take over this one? We did look into it, yeah, for sure.
Yeah, we did. We actually looked at those elements separately. So we explored the aspect of the interactiveness to understand to what extent a user can adjust, for example, the way that the data is being visualized to change from a table to a figure, to select and zoom into a particular region of interest. And we found, and through the scoring of the dashboards, that element of interaction was favorable in terms of being able to navigate for the information of interest to an individual. But I agree that we did see in some instances where it can have a pitfall where it's an over or perhaps complicating. So the clarity of the audience of who was the intended user and how one would expect for them to navigate the information was clearly linked to the usefulness of that interaction. And separate to that was the aspect of the storytelling, which was extremely important and unfortunately not as often used as we would have hoped. And we separated, or we looked to storytelling on two elements. One was the aspect of the data and the explanation of what is included in the figure that you're viewing, so how that number has come to be. And that was one element of storytelling. And the other was explaining what the trend you're looking at tells you. Is this an improvement or a decrease in a particular direction? And while a hugely beneficial to remove the element of the individual user interpreting, that was unfortunately not often done, at least at the start when we were assessing the dashboards in spring of last year. So we're hoping to see some improvements, but also to understand from the developers why that storytelling element was not done as much as we expected to see.
Oh, thanks, Erika. Any further questions? I see some remarks coming in the chat box. I'm seeing the English version. Don't know the Russian one. Can I just check whether any questions in the Russian dashboards that I'm not aware of? Not yet. Then I see a hand is raised by Ajidas in Italy. Please, your reflection.
Yeah. Good morning, Nick. Thank you very much for this presentation. Obviously, as you know, we are interested in Italy on the analysis also of the COVID portals we have at sub-national level, which is an interesting feature because we have also an interesting to gaining more insight and also providing recommendations to the regions on how to develop their dashboard. My comment also, actually, the question would be for, obviously I know HealthPros have been collaborating and I'm very keen to collaborate with the network for the definition of the methods of this new approach. But I was also curious to know from the WHO Europe perspective, what would be the output of this study? I mean, are we trying to achieve recommendations for new portals in the future after COVID for preparedness? I mean, are we trying to achieve a better harmonization of these dashboards, or which would be the potential output of this study, hopefully after the pandemic has finished? I mean, what are we going to learn, and how is WHO Europe to work on this after the end of this study?
Thank you very much for that question, Fabrizio. Overall, for the moment, we from the HealthPros perspective see it as creating a learning network, sharing as much the insights and the intelligence about what are actionable dashboards. And as Erika presented, we hope that at the end of this this work, the biggest added value is building this community and exchanging the information, but also putting it down in reporting and in a scientific paper. But overall, of course, doing this with WHO Euro has the broader idea of trying to increase learning, but also through learning, try to harmonize insight. And I think this is an excellent moment to hand over to David again, perhaps to answer this question, but then also to round up this launching event, because we have 5 minutes left. And I think I'm very positive about the responses so far. So thank you. Really looking forward to of being in touch with all the groups. And if you have more centers you are aware of that didn't participate in this meeting so far and are not in our network, but should be participating, as Erika said, please reach out, because we really might like to make this a community effort. And with that, I happily hand over to David, who can perhaps answer the last question for Fabrizio and round up the meeting.
Yeah, absolutely. Thank you so much, Nick, and thank you so much, Fabrizio, and good to see you again for your question. Yeah, I mean, Nick has summarized very well what is our purpose with this study. So we are trying to document, systematize the good practices, and to be sure that everybody can have access to this lesson learned. I mean, during this pandemic, we have learned already that one of the main problems has been the management of the health information systems. I am not the responsible officer for the health information system for surveillance, so I cannot talk on behalf of my surveillance, my emergencies colleague. But we can say that this is an important study for all of us to learn from what has happened and to be sure that we are prepared for what is coming next. And of course, good to see you, and I hope that we can work together to have this work done. So I think that with this, and as Nick said, we would like to conclude this webinar, but not without thanking you for taking the time to meet us today, for making data and health information a priority in these challenging times. We would like also to thank you, Lyudmila and Tatiana, our interpreters. So this is just the beginning, and you all have our contact information, so you need to contact us. Please do not hesitate to reach out. And with that, and on behalf of the World Health Organization and the HealthPros Network, thank you so much again for your participation today, and have a good day. Thank you so much.